Hello, my name is Doreen Bird. I'm from Santo Domingo Pueblo, New Mexico. And today I want to talk to you about suicide prevention in Native American communities. I do tend to use the word tribal communities a lot, but I'm talking about Native American communities, American Indian communities, rural and urban populations. So one of the challenges we have in suicide prevention is that our Native American youth have some of the highest suicide rates in the country. And although that is a generalization that's made, I think it's really important to note that tribal communities are really unique and genuinely different amongst each other. So it's important to not generalize and say all Native American communities have high suicide rates. Some of our tribes have very low suicide rates and some have zero. Some of the challenges that we're facing in doing our work in suicide prevention is that some communities consider it taboo to talk about suicide or to even say the word suicide. And so it's important to gauge how ready is your population to tackle this subject. There are generational differences in communities as well. I've seen where elders have a harder time saying suicide and talking about death, where the youth are just ready to talk about it. It's no sugarcoating with them. Another challenge that I'm seeing when doing the work in suicide prevention with Native American communities is cultural competency. There are so many unique tribes in our nation. You can't be culturally competent with each tribal community. And so it's important to note that you don't know everything, and it's also important to build off the human aspect. We're all humans, and so when doing work with Native American communities that you may not know everything about, I like to go back to being human and being genuine. When we have people coming new to our community, we often like to share a meal, and I say break bread with the people that you're working with. That's a very important and easy way to build authentic relationships with the communities that you're working with. Another one of the challenges that we're facing is using evidence-based practices in our communities. Oftentimes, that evidence was based on a population that didn't include Native Americans. So when we try to bring those evidence-based practices into our communities, oftentimes there's a clash of values that occur. There's a term called practice-based evidence that's kind of on the flip side. When you're facing a clash of values, you need to go to the people that you're working with and include them in your program development, because ultimately they know what works in their community and you can build off of the strengths that they have. One of the recommendations that I'd like to share is changing the paradigm of the way we talk about Native American communities. Oftentimes we hear of all the risk factors, all the negative health problems that we have, and I think it's time to change that paradigm and start talking about what are the strengths in our communities. What's protective? What's made us so resilient that we're still here today, given all the trauma that some of our ancestors have faced, yet we're here still and we're proud and we like to move forward in a positive way. When I heard the Surgeon General said that connectedness is a protective factor in suicide prevention, I was really excited because I think, wow, that is something that Native Americans are really used to, and that's something we can build off of. We're connected to our culture, Native Americans are connected to the land that we come from, and we're connected to each other in a way that it's really hard to explain. It just comes through our being that we have this connection as Native people no matter where you are in the world. And so when you're doing your work of suicide prevention in Native American communities, consider the term connectedness and see how you can use that to inform your program. Working with tribal populations on suicide prevention, it's really important to bring in the community members with the work that you're doing. This empowers the community, and it ultimately makes your program, your services, your engagement with the community a whole lot better in reducing suicides.